All right, let's look at this foreign body airway obstruction. When we talk about foreign body airway obstruction, we're speaking of something, primarily what happens is people talk and eat at the same time. And when you're speaking, your epiglottis is open, and then the person swallows the food, and then it gets lodged potentially between the vocal cords. That's what would be considered a full body airway obstruction when whatever, let's just say the ribeye got stuck between the vocal cords. The good thing about it is that if someone knows the Heimlich, they can come up and do the Heimlich on you and potentially remove the foreign body. We never, even if you were to exhale as hard as you could, you never exhale all the air that's in your lungs. It's called a residual capacity, and I want to say it's like 1,500 milliliters. It's quite a bit of air. And so that residual capacity is what we use when we use the Heimlich. We're forcing that air up by pushing in on the belly. It's forcing that air up and trying to remove that object from between the vocal cords. The other one is a partial airway obstruction, and this partial airway obstruction is where you can still speak or make noise. That's just a partial airway obstruction. Then you wouldn't do the Heimlich. You would just tell the patient to cough, stand them up, let them cough, try to get them to cough. Once they stop making noise, then it becomes a full body airway obstruction. So, has anyone ever had to do the Heimlich? My EMT class this summer, one of the guys in that, he was at Emory. Huh? Oh, he was at Emory. He's a police officer down there, and they were at a luncheon at the school, and the janitor was choking, and he was sitting at the table with 3 other people, and no one knew what to do. The school nurse was sitting across the way and just kept eating. He had to come from quite a distance over and do the Heimlich on this person to get his airway cleared. So it does happen. This will probably be what you will see more than someone going into cardiac arrest, because people have such a tendency to eat with their mouth full to come around. So make sure that if they're not speaking, they can't speak, they can't make any other sound, then you rest assured that they have a full body airway obstruction. What you will do is you will get behind the patient like it shows here in the picture, find the belly button and the xiphoid process, put your hand in between the two and push upward with an upward thrust. Now that's for a conscious person. And you would do that either until they became unconscious or the object came out. Once the object comes out, then the emergency is essentially over. They're still going to sort of spit and gag a little bit, but it's pretty much over with. The Heimlich works very good if you do it correctly. It's not something that you practice on each other. It can be quite dangerous. So we don't practice it on each other. That's why we have the mannequins. And like I say, in a mild blockage, it's just where they can speak, or they cough, or gag. They're essentially moving air, but they're still having trouble with that. It's the food or whatever is still back there, so just have them cough. That coughing motion will push that back off the vocal cords or the vocal folds. Then, like this guy here, they do this most all the time. It's a universal sign for choking. People who are choking will get big-eyed, and then they will do this up around their neck. They sort of lift their hands up like this, and they'll be going. And then you would get behind them. You'd come over and say, "Are you okay?" And they go, "Are you choking? Can you speak?" help you. And you would get behind them and do that. It's important to ask them all those ridiculous, I know they're ridiculous questions, but you're trying to get them to speak, to see if they can speak. If they can't speak, then you know they're choking. You want to let them know that you're helping them, so you just don't jump behind them and grab them. That will scare them, you know. So let them know that you're going to help them out. Did you have a question?
What would you do once someone's unconscious after choking?
We'll get there. We're not there yet. All right? So we know we've already went through the steps. Are you choking? Can you speak? Go ahead and activate the 911 system once you realize the patient's choking. You may clear the airway. In time the ambulance gets there, it's all done. And really, most of the choking calls that I've been on, it's already done by the time we get there. Someone has done the Heimlich, or they've got the out. My son one time did the Heimlich on himself. He got choked, and he went over to a chair and started pushing his abdomen to the chair. And the obstruction came out as well. So you can sort of self-administer the Heimlich. Like I said, position them. The position is important. Make sure you get the hands in the middle. You get too far up on the rib cage or too far up, you have the xiphoid process there. You could break the xiphoid process off, and when that breaks off, it has a tendency to lacerate the liver, which would be life-threatening. Then they have more problems than that choking. Quick thrust until the patient coughs up the object. If the patient becomes unconscious, then you would lower them to the floor, activate the EMS already, and the new standard here is to begin CPR. So you would start chest compressions. Now, I'm not on board with this whole chest compression thing. All right? But that's what, if you see it in a testing situation, then an unconscious person, you would begin compressions. All right, so begin chest compressions. If you see the object, go ahead and remove the object. However, be very careful with the fingers. What happens a lot of times when people get hypoxic, what's hypoxia? No, you think you don't have no oxygen. Right, lack of oxygen to the cells. So when they get cerebral hypoxia, they have a tendency to seize. And you don't want these things, you don't want your fingers in their mouth when they're seizing. They bite them off. You come up like that. Then you have two airway obstructions in there. Your finger will be in there, and then the other one.
Really?
So you know, no, really. They bite it right off. I've had a patient seize before with their laryngoscope blade in their mouth, and they clenched down, they bit down, and I've picked the patient up, picked their whole thorax up off the bed trying to pull my laryngoscope blade out. They didn't bite it too because it's metal, but they had a grip on it where I could pick their thorax up and try to get my blade back. Yeah, it's not good on the teeth. Anyway, breathe in to see if the airway obstruction is still there. When we talk about pregnant patients or obese patients, you do have to go higher on the cavity. You have to go up towards the xiphoid process, so be very careful with that when you get there. Just try to avoid the xiphoid process. A child is very similar, except a conscious child and infant, see which one it goes in through here first. The child is the same method as you would do the abdominal thrust, but just with a little bit less force. You don't need as much force as you would an adult. So kneel by the child, and then some people would do it with one hand, like you would do the CPR. Unless you're small, then you can do it with two hands, but just with less force. And then the same thing, same step process. Go up beside them. Are you okay? Can you speak? Kneel beside them. See, this person here's doing it with the one-handed method. And and then the quick thrust up. If they become unconscious, we've already activated the 911 system, and then to go with consistency, go ahead and start the compressions. And if you see it, then remove it. The infant is quite different because they're not standing, right? So let me grab my baby. When you have the infant, remember these guys won't lift their hand up like that. What the infant will do, and this is highly likely that you will get into this situation because of the fact that mom's going to be freaking out. She's going to be the one who panic. And don't be surprised at all if someone tries to hand you a baby. Go, I don't know what to do. They're choking. Like, okay, you think I do? But the baby will just get real still. You can see it in their face that they're not breathing. They get this thing like someone just took the airway from them. So they will get very, very still. And keep in mind that babies always explore with their mouth. Toddlers, they're picking things up, putting it in their mouth. So you have to be very careful around the house. So they can become cyanotic around the lips, and in the extremities. Of course, you would activate the EMS system. Then you would turn over in a conscious baby. The same thing. You flip them over, let gravity do its work, rest them on your arm, and then do 5 back blows, and then flip them over and do 5 chest thrusts. So 5 and 5, and then you look inside to see if you can see anything. If you can see something, then go ahead and pull it out. If you can't, then don't put your fingers down in there because you might force the object. Then you would breathe for them while they're still conscious. Never mind. So they're conscious, and you can still see that they're choking. They can't breathe. And you repeat that 5 and 5 until something came out. Now, here's the thing that most people do with this. The back blows, the little kid. They go, I don't want to hurt the baby. Remember, they're pliable. They're cartilage. I mean, you got to hit them, like they just pooped on you or something. You go 5. Sharp back blows between the shoulder blades. You're not trying to break their shoulder blades, or their spine, but you want to give sharp back blows, good chest thrust to force that object out. Right? Any questions there? Everybody good with the babies? Because they will definitely, you'll be at a restaurant or something, and this is a probable happening. If the patient becomes unconscious, it's the same process to start the CPR, start chest compressions.
Would you recommend that for babies or do
Yeah, babies, good question. Babies won't matter. You're not going, they're all cartilage. So you're not going to separate the sternum here. You would just do the compressions. And there's not, even in old school, there wasn't abdominal thrust. There's just, we just kept doing back blows and chest thrust. But here they're recommending that you go ahead and start doing the compressions.